We Embrace, a podcast focused on discussing insights on disabilities. We have two goals. First, to build awareness of the lived experiences and realities of individuals with intellectual and developmental disabilities and their allies. And secondly, to offer life-affirming, practical approaches for some of the more common challenges they may face. We will also celebrate the outstanding accomplishments and advances and support mechanisms, policies, and indeed the accomplishments of those living with disabilities. Our guests will include people with disabilities, parents, caregivers, and professionals. Hi, I'm Nicole Attown, Executive Director of the FIU Embrace Center for Advancing Inclusive Communities, where we aim to empower each differently abled person to live at their fullest potential through research-based, innovative programming, community engagement, and professional skills development. As always, we welcome you to learn more about our work at FIU Embrace, our programs and services to support individuals with disabilities by visiting fiuembrace.fiu.edu or scanning the QR code now on our screen. On today's session, we address aggression. We want to first acknowledge that sometimes our children's inability to manage their emotions result in them being aggressive towards themselves and or others. For many families, aggression is a part of our life that comes in waves but never ceases. We also acknowledge that whenever it happens, it pulls the rug from out under us and rips at our core because as parents we blame ourselves that somehow we did not support and protect our children. This is a lifelong journey for many. But we can get help with managing and building a support system for ourselves to see us through these difficult times. With me today is Dr. Yogi Hernandez Suarez, Senior Associate Dean for Student Affairs at Herbert Wertheim College of Medicine at FIU, an Associate Professor of Obstetrics and Gynecology. She's here to share her lived and professional experience with us. Welcome, Yogi.
Hello, Nicole.
This is certainly a difficult topic. I know I myself have had some experiences at home. And while there have been few and far between, I know that there are many people out there living with aggression in their home constantly, almost every day. What would you say to them? How would you address this topic with them?
Let me just acknowledge that this is a challenging subject to talk about, even for professionals. It is what I would think about where domestic violence was maybe 20 or 30 years ago.
Certainly.
There's a lot of underestimation of the frequency of this problem in homes. There's shame. Physicians and other clinicians don't ask because we're not really sure what to answer or how to remedy. But let me share with you, as you know, that this is there is an incidence of aggression toward others or toward self along all of the spectrum of autism. So we can see this in what we would call high-functioning individuals, as well as more impacted individuals. It changes somewhat across the lifespan, and I think because there is a societal framework in small children for this type of behavior to frame it as a tantrum, although this is not a tantrum, that we can somewhat, manage this when our children are very little. Although I recall getting, prejudicial looks when, when my children were acting in that manner, sort of like, what a bad parent, what a bad set of parent that you can't control your small children's behavior. This gets more challenging as our children age. And we do sometimes see an increase in aggression or self-injurious behaviors in adolescence, for both boys and girls. And then it can continue throughout the lifespan. You can imagine that how this is viewed or seen by society or it is very different when you have an adult who is, going through this. It's a somewhat predictable set of behaviors. Parents or caretakers who know their folks can kind of tell when something is brewing. You have a sense that's it's almost like a watched pot that we know is going to boil and that we know is going to overflow. And then after it goes through its process, it takes about 20 to 30 minutes, so this is not just a couple of minutes. Mm-hmm. There is a rather predictable denouement where the affected individual is tired, is weepy, frequently contrite and embarrassed, and then it has to kind of then regain its the normalcy of the behavior. I believe that it is underestimated, just as when we, as an obstetrician gynecologist, as we underestimated domestic violence because we don't ask. Yeah. When we began, predictably to ask women, do you feel safe in your home, and to ask it in a manner that was, forthright, and then to be able to have a response when somebody said, no, I don't. I think we're going to have better estimates of what families and group homes and other caretakers are struggling with when we ask the question. Yeah. And again, it is across, just like domestic violence is across all socioeconomic classes. Yep. Aggression and self-injurious behavior can be seen across the lifespan and across the spectrum in verbal and nonverbal people.
I'm a psychotherapist by trade, and you would expect a person like myself as a professional to be able to respond to these behaviors in a very methodological way. But I remember as a parent, just putting on my parent hat here, how difficult that was. Yeah. As I saw, you're correct, as I saw the escalation. And yes, it's sort of this peak and then this sort of downhill flow and back into sort of normal, quote unquote, normal behavior. Yeah. It takes a while. It's a protracted experience. Yes. And I particularly remember when this happened, when my child was late adolescence. I didn't know how to approach the doctor. I didn't know which doctor to approach. You're right. I felt ashamed and not really knowing where to go next. How would you approach this? Which doctor should they go to? What advice would you give to families?
I think it's a really good question. Access to care for people with intellectual and developmental disabilities remains a challenge in this country. We do not have enough doctors that are trained to understand and respond to this population. When we do the math and the increase in the numbers of people, children, that we are diagnosing with developmental disorders, and you pull that out through a lifetime, because these children become adolescents, these adolescents become young people, these young people become middle-aged people, and frankly, we don't know what these people look like in advanced age, but they will have a continuum. Really, it should be part of what any primary care doctor can encounter. So for children, you should be able to approach your pediatrician. As you get older, you have your PCP, but I can tell you there have been multiple studies looking at the care of people with autism specifically in the United States, and doctors are not well prepared. Not even pediatricians, who you think would be the best prepared. When we query in a scientific study and approach and talk to residents, these are doctors in training, how comfortable do you feel talking to a family with a child on the spectrum, they have more comfort with the diagnosis,
Right.
but then begin to lose comfort and ease with talking about the consequences and the managing of, much less the managing of difficult behaviors.
I see.
So we have a long way to go. And it's interesting, other countries are doing better at this than we are. So when you look across the pond in England, for example, in Great Britain, it is a mandate in the medical and clinical field that anybody who is working with people with intellectual or developmental disability have special training and keep up that special training year over year. It's going to take that kind of advocacy in this country to help prepare our clinical workforce to take on these challenging questions. Now, the next question is, okay, you bring it up, they're receptive. What are the interventions that we have around this? And this is tough because it's not a one-size-fits-all.
Right.
There are behavioral interventions, as you know, but I can tell you in the moment, it is very challenging to extinguish this once it is on its path.
Yes, at a certain point you can't stop it. It has to move through the cycle.
You are correct. That is exactly what it feels like. And if you protract it or prolong it, it's just, we as families know it is going to come, it's only going to come later.
Yep.
And so the question is, how do you understand or prevent that from happening? And it's challenging. If this has been studied, are there triggers? Is it a sensory overload? Is it? But I can tell you for individuals, in studies you can look at trends, but for individuals, it is very challenging to identify what the triggers are.
Yep.
It can be sensory things that you don't understand or that is perceived only by the impacted individual.
It could be change in environment.
It could be change of environment.
Right.
You know that change for these individuals in general is challenging, and you may not recognize the change, but they do.
Yes.
It could be environmental stimuli. And so we are left, unfortunately, with not an easy approach. There are some medications that are mood stabilizers that psychiatrists who have particular experience with this population can be helpful, and it sometimes take a multidisciplinary approach of pharmaceutical approach, behavioral approach, an understanding of how to respond when it happens and how to keep yourself and the individual safe.
Yes.
Because it can escalate to a point of self-injury that we want to avoid. So what does that mean? How do we respond? Do we come in? Do we not come in? Do we offer a stabilization on the floor? If you're going to try to hold the individual, is there a manner in which you can be trained to do that so you don't hurt yourself or the individual? This is complicated. This is complicated.
I want to go back to a point you made earlier about education of the workforce.
Yeah.
I remember clearly that I had to spend time training and talking through with my daughter's physicians about how to work with her, how to speak to her, how to engage her. I clearly remember when I was getting the diagnosis, the doctors did not know how to speak to me about what she has and what that looked like. It felt like in some ways I was consoling them because I didn't know what it was either, and I didn't understand at that point how different my life would be.
Yes.
I wonder, you are here at FIU at our medical school, and what are we doing about this with the new people coming through education?
Well, there's a lot of advocacy now to try to help physicians and other clinicians that interact with all kinds of patients to have a sensitivity toward this particular population. It's not easy to get time on a medical school curriculum. Yes. So you can imagine all the competing new information that emerges all the time.
Yep.
And so what's interesting about our medical school is that we have what we call a population health approach. What does that mean? That means that our students are trained to look at groups of people as well as individual people. So when I talk to my students, I say, well, we have the numerator, that would be the individual patient, but we have the denominator. And so a lot of emerging public health issues are in that denominator. And if 3 to 5% of our population is going to have an intellectual or developmental disability, that's a lot bigger percentage than some of the very complicated illnesses that we spend time studying, right? So when you think about where should I be spending my time, what should I understand? Understanding this swath of people is very important. I believe we've come a far way in the diagnosis and understanding in children. What is left is this lifespan approach, this idea that these people don't get better, we're nowhere near a cure. We now have to follow people on their journey. And we've seen this with other things, right? So when we think about other childhood diagnoses like sickle cell or other congenital illnesses, we now realize that these young people live for a while. And so how are we meeting them? And how are we as doctors preparing the physician workforce to not just make a diagnosis, but then to follow and help on the journey and to listen, because the insights and the issue spotting is coming from the families. If you ask us, we will tell you. And then you need to be prepared to think about how to act to help us. But we won't tell you if you don't ask, because there is a lot of shame, I believe, still around this, or stigma. And so, you know, it was the same with, I go back to domestic violence. You know, women were not being forthright about these stories because they felt embarrassed or, you know, didn't want to have connotations. We talk about legal connotations, right? So when our kids are little and they, you know, have a meltdown, you pick them up and you stick them under your arm and you go.
It's easy to manage, right?
Correct. But when you have a big strapping man, you know, have a meltdown, we worry as parents that they could be, you know, have legal complications, that they could be, you know, the police could be involved, that they could be incarcerated. So we are, you know, very careful about what we reveal about what happens in our homes, worried about the consequences that may happen. And so it's not just the education of the clinicians, but it's also the education of the service people to understand when they come across this.
How do they react?
How do they react? Because they can make it far worse. And if they are educated, they will understand that this
is an arc.
That this will come down. But that is a challenge also. I'm very proud that the FIU police force has been so engaged with FIU Embrace. And I, as a parent and, you know, whose kids are involved in the programming, one of the great, you know, sense of relief I have is understanding that FIU's police department, under the leadership of Chief Casas, has been such a good partner, such a willing and to learn and understand and collaborate and be with us on these, the good and the bad.
Yeah, we are grateful for Chief Casas and his team. I want to go to another part of this. I mean, this topic is so broad, we could not touch everything on it. But this is an important piece for me personally because it happens. If it's happening to me, it's certainly happening to many people out there. Let's talk about families being around. You're going to visit a family. It's a birthday. It's a celebration. We get together. Thanksgiving is coming. There are times when our children sort of escalate in the middle of a family environment. And it is difficult. We have to manage their response. We have to manage their escalation. But also we now have a group of people who, from my perspective, I think are outside of their element. They don't know what to do. And I wonder, I've been thinking about this a lot, about what we should be doing to help our extended families in their response, what they should do, because I know they want to be helpful. And I know they don't want this to happen. But what can we do? What should we be telling them?
I don't have a great answer for this. And I have to tell you that for us, there were periods in our life that we were very socially isolated because of some of that, right? And speaking of family, there are consequences then to siblings.
Yes.
And you know, we carry that with us as well.
Yes.
How do you manage neurotypical siblings or siblings that can manage and enjoy social outings,
yes,
or who get left out because we are isolating because we don't know how to manage the question you just asked, or because that the siblings become afraid.
Yep.
Afraid, nervous, anxious around these individuals because it's very hard for grown-ups to understand this. Imagine, you know,
yeah,
other little kids that all they see is what they're seeing.
Yeah.
And that has been a challenge for us as well. And I know I don't have a great answer. I put it back to you, but for us it has been, you know, we have a very small group. We have a very small tribe.
Yes.
And that is the tribe that, you know, loves us, has been on the journey with us, and you know, I need not explain.
Yes.
I don't have to, but it has been socially limiting.
Yeah. I mean, it's the same for me. I think I have retracted as well. Because I don't want to explain and I don't want anything to happen.
It's inexplainable. How do you talk
yes,
about this?
Yes.
It is only with an outpouring of love that when we see that from family members, that you say, okay, you're my peeps.
Yeah.
Because on top of everything, you know, stopping at, you know, to explain what's going on, it's impossible.
Yeah.
And so, but there are people who just in that moment have 100% love for you and your kids.
Yes, at that time. Yes,
right.
Yes.
And so when you see that, it's extraordinary, and you're so forever grateful for that. And then you know that then this is the tribe that's going to be with you on this particular journey that you've been given.
I know there is a lot to cover. We're out of time. I want to pick this subject up again. But when we do the training where we can have more professionals around to sort of talk through what are some of the strategies that families can do, how to get help out there, because there is help. I know I've been fortunate, right? We've had the ability to sort of calm things down and to tackle these behaviors in a different way. I know it's possible. And so I'm going to invite you back to our discussion where we have other professionals around the table to sort of talk about different aspects of this. And hopefully we can come to something and people could learn more about it.
I think that's a great idea. I'd be happy to return. And on a hopeful note that there are people, good people, trained people who know how to help shape some of these behaviors, decrease the frequency.
Yes.
And know how to respond when the going gets tough.
Yep.
And so I look forward to that panel and would be happy to return.
Thank you. Thank you for joining us. It was a pleasure having you here. This is certainly a difficult topic. It's something that we all face, and there are many people out there walking this walk alone. I invite you to come back. Stay connected to us through fiuembrace.fiu.edu. We'll announce when we're having the discussion with professionals at the table to provide strategies to you and your family about how you can deal with this. Until then, thank you for joining us.